Your doctor said he thought you had a rotator cuff problem and sent you for an MRI.
Yes.
This was the one you had in July, I think, a couple of months ago.
Yes.
Right, so I've got the report here. We're not going to put the imagery up because that wouldn't be...
Did I pass?
So this was compared with your previous MRI in 2003, but it just simply says that C56, C67 disc protrusion causing bilateral foraminal stenosis and neural compression more marked on the right side. Now, foraminal stenosis means that the holes where the nerves come out are a bit narrowed, so therefore they could be compressed. He says some neural compression, so some compression of those nerves. So that could be a culprit. You've had nerve conduction tests?
Yes, I had conduction tests, which was all came back as normal, and then I was sent to see the physio.
Right.
That went really well. The chap was quite upset with me and asking why was I being sent to him when the GP had said it was rotator cuff. He said, when it's quite clearly not, it's your neck.
Right.
Yeah.
Well, good for the physio for
so I
spotting that.
said, great question, asking the wrong person. Yeah.
But the answer is actually clear. It's what I said earlier on. GPs are not musculoskeletal specialists, and many of them don't know. So he sent you to someone who does know. Who does? A physio.
Yes. However, he then decided to do an examination where he hurt me. He worked his way down my back of my neck, found a little lumpy bit, gave it a push, and my arm instantly went very numb and almost with like a burning sensation. And I said, please don't do that again. And at that point, I feel he sort of had his thumb on it, put his hand on it, and gave us a really good push, which made me jump off the table. As you can see, I'm not exactly a small chap, and jumping up, and straight away he went for, I can call security, you know. I'm not violent. I wasn't going to attack him.
This is a show about safety, and we're building in some communication and consent issues in this as well. Laurie, I'm jabbering away. You're the expert. Give me some of your opinions on how this was handled.
If I heard that history that I heard before upstairs, I would, for the first 20 years, I would have said you must have an X-ray before I can do anything.
X-ray?
Or MRI scan, which is a lot better. And he's done that. Nowadays, I would say I'm going to put my hands on it, see what's there, and if there's no reason why I can't manipulate, I would go ahead and apply the techniques I normally do, which involve lots of different levers, and therefore it's getting to those joints without straining them.
Yes.
And I've looked at his neck, and it is very tight, and I think I can free that up quite a lot. Okay. But not by ripping it round, by using lots of tiny levers and very gentle thrusts.
So what do you think about the way this patient was handled by his physio?
I think that's awful, frankly.